system's first line of defense against infection. Coping with stress, patients receiving high doses of corticosteroids do not tolerate stress well. Explore coping mechanisms that person uses in response to stress. Stress is a complex, dynamic process of interaction between a person and his or her life. It is a way we react physically, mentally, and emotionally to various conditions, changes, and demands of life. People react differently to stress. How you react depends on your strategies for coping with stress, your previous experience with stress, your genetic makeup, and your level of social support and how you view your social support. Avoid infections. Advise the patient to avoid crowds or people. Advise the patient to avoid crowds or people known to have infections. Patients, their family, and the people surrounding them play an important role in infection prevention. Take time to educate them on the infection prevention basics and help them to feel comfortable asking questions and voicing concerns to healthcare professionals in your facility. They should know how to avoid the healthcare-associated infections, feel empowered to speak up for their care, know to clean their hands often, and understand the basic needs of patients. Nutritional status: assist the patients in developing specific schedule for spacing, daily fluid intake, and planning sodium restrictions as prescribed by the physician. Good nutrition prolongs independence by maintaining physical strength, mobility, endurance, hearing, vision, and cognitive abilities. Nutrition education can be defined as any set of learning experience designed to facilitate the voluntary adaptation of eating and nutrition-related behaviors conducive to health and well-being. It is an integral part of providing nutrition service to older persons. Activity and exercise. Participating in regular exercise is essential. Encourage weight-bearing measures to prevent calcium use. Individual unable to attain the degree of activity anticipated as a result of drug therapy may become frustrated. Physical activity in our daily lives is determined by a web of factors that has become more intricate over the past century as advances in science and technology continually change our world. Now we have the fostering health maintenance. One of the major goals of healthy people is to help individuals of ages increase life expectancy and improve their quality of life. The concept of health promotion and health maintenance provide interventions that contribute to meeting this goal. Healthcare management is a holistic profession that examines and works with all aspects of individuals' lives and a strong focus on family and community as well. Therefore, it should be uniquely positioned to provide health promotion and health maintenance activity. In fact, this activity should be a part of each encounter with families.
Everyone, I am Tisha Jane Salamida and reporter for this slide. Branding: fludrocortisone. Actions: fludrocortisone is adrenal corticosteroids with potent mineralocorticoid and glucocorticoid effects. It affects fluid and electrolyte balance by acting on the distal renal tubes, causing sodium and water retention and potassium and hydrogen exertion. Uses: hydrocortisone is used in combination with glucocorticoids to replace mineralocorticoid activity in patients who suffer from adrenocortical insufficiency or Addison disease. And for the treatment, salt-losing adrenogenital syndrome. Therapeutic outcomes. The primary therapeutic outcomes expected from fludrocortisone therapy are the following: control the blood pressure. Second, restoration of fluid and electrolyte balance. Nursing process for fludrocortisone pre-medication assessment. First, check the electrolyte reports for early indication of electrolyte imbalance. Second, keep accurate records of intake and output, daily weights, and vital signs. Third, question the patient about any signs and symptoms that would indicate the presence of infection. Fourth, Perform a baseline assessment of the patient degree of alertness, orientation to name, place, and time, and rationality of responses. Fifth, ask the patient about previous treatment for an ulcer, heartburn, or stomach pain. Testing stools for occult blood should be done periodically. Nursing process for fludrocortisone, planning, availability per RM to 0.1 mg tablets. Implementation, dosage, and administration, adult per RM 0.1 mg daily. Dosage may be adjusted as needed. Cortisone or hydrocortisone is usually also administered to provide additional glucocorticoid effects. Evaluation. Because of fludrocortisone is natural hormone, side effects are an extension of excessive use of fludrocortisone. Most side effects are associated with sodium accumulation and potassium depletion. Side effects. Expect and report. See the glucocorticoids. Drug interaction. See the glucocorticoids. That will be the next report.
Cortisone actions. The major glucocorticoid of the adrenal cortex is cortisol. The hypothalamic pituitary axis regulates the secretion of cortisol by increasing or decreasing the output of corticotropin releasing factor or CRF. From the hypothalamus, corticotropin releasing factor stimulates the pituitary gland ACTH, then stimulates the adrenal cortex to secrete cortisol. Pre-medication assessment. Check the electrolyte reports for early indication of electrolyte imbalance. Maintaining the right balance of electrolytes helps your body's blood chemistry, muscle action, and other processes. Sodium, calcium, potassium, chlorine, and phosphate and magnesium are all electrolytes. Keep accurate records of intake and output, daily weights, and vital signs. Number 3. Question the patient about any signs and symptoms that would indicate the presence of an infection. Number 4. Perform a baseline assessment of the patient's degree of alertness, orientation to name, place and time, and rationality of responses. 5. Ask the patient about previous treatment for an ulcer, heartburn, or stomach pain. Testing tools for occult blood should be done periodically. Nursing process, dosage and administration. When therapeutic dosages are administered for 1 week or longer, it must be assumed that the internal production of corticosteroids is suppressed. Abrupt discontinuation of glucocorticoids may result in adrenal insufficiency. Therapy should be withdrawn gradually. The time required to decrease glucocorticoids depends on the duration of treatment, the dosage amount, the mode of administration, and the glucocorticoid being used. Abrupt discontinuation. Patients who have received corticosteroids for at least 1 week must not abruptly discontinue therapy. Symptoms of abrupt discontinuation include fever, fatigue, weakness, and anorexia, nausea, dizziness, hypotension, fainting, and hypoglycemia, muscle and joint pain, and possible exacerbation of the disease process. Dosage and administration application. Topical corticosteroids are applied as directed by manufacturer. Specific instructions regarding use of an occlusive dressing should be clarified before application. Dosage and administration. Alternate day therapy. Alternate day therapy may be used to treat chronic conditions. Corticosteroids are usually administered between 6 a.m. and 9 a.m.
to minimize suppression of normal adrenal function. Administer with meals to minimize gastric irritation. Pediatric dosage and administration of pediatric patients. The correct dosage for a child is usually based on the disease being treated rather than the weight of the patient. Monitoring of skeletal therapy is required. Evaluation, side effects to expect and report. Electrolyte imbalance, fluid accumulation. The electrolytes most commonly altered are potassium, sodium, and chloride. Hypokalemia is most likely to occur when many symptoms associated with altered fluid and electrolyte balance are subtle and interspersed with general symptoms of drug toxicity or the disease process itself. Susceptibility to infection. Always question the patient before initiation of therapy about any signs and symptoms that would indicate the presence of an infection. Corticosteroids therapy often masks symptoms of infection. Behavioral changes. Psychotic behaviors are more likely to occur in patients with previous history of mental instability. Corticosteroids reduce GABA, leading to anxiety changes in mood, depression, seizure disorders, and a decreased capacity to cope with chronic pain. Peptic ulcer formation. Before initiating therapy, ask the patient about any previous treatment for an ulcer, heartburn, or stomach pain. Periodic testing of stools for blood may be ordered. Antacids may also be recommended by the physician to minimize gastric symptoms. Delayed wound healing. Surgical sites of patients who have recently had surgery must be monitored closely for signs of dehiscence. Hypothesis: anti-inflammatory corticosteroids significantly impaired wound healing. Drug interactions. Diuretics. Corticosteroids may enhance the loss of potassium. Many symptoms associated with altered fluid and electrolyte balance are subtle and interspersed with general symptoms of drug toxicity or the disease process itself. Gather data about changes in the patient's mental status, alertness, orientation, and confusion, muscle strength, muscle cramps, tremors, nausea, and general appearance like drowsiness, anxious, and lethargic. Warfarin. Steroids may enhance or decrease the anticoagulant effects of warfarin. Observe for the development of petechiae, ecchymosis, bleeding gums, dark tarry stools, and bright red or coffee ground emesis. Monitor the prothrombin and adjust the dosage of warfarin if necessary. Hyperglycemia. Diabetic or pre-diabetic patients must be monitored for the development of hyperglycemia, particularly during the early weeks of therapy. Assess regularly for glycosuria and mood glucose, and report any frequent occurrences. Patients receiving oral hypoglycemic agents may require an adjustment in dosage.